The call came in at 11:47 p.m. 6 black SUVs. No plates. They blew through the ambulance bay at Harlow Ridge Regional Medical Center like they owned the asphalt, and every security guard on the night shift froze. The men who stepped out weren't cops. They wore no visible insignia, but they moved like something trained, precise, and dangerous. And they were asking for exactly one person. Not the chief of surgery, not the hospital administrator. A nurse. "We need Mara Voss right now. Tell her Bravo Element is here." Nobody on staff had any idea who Mara Voss really was. They were about to find out. If this story already has your pulse up, you're in the right place. Hit subscribe so you never miss what happens next, because the stories on this channel do not slow down. Drop a like on this video and tell me in the comments, what city and country are you watching from? I want to see exactly how far this story has traveled. Now, let's go back to where it all started. It had been raining since Thursday. That particular detail mattered to Mara Voss only because it meant the ER at Harlow Ridge Regional was running at 112% capacity, the trauma bays were stacked, and she'd been on her feet for 11 straight hours without a break long enough to finish a cup of coffee. She wasn't complaining. Complaining required energy she didn't have, and it required an audience that cared, which the overnight staff at Harlow Ridge had stopped being about 3 months into Dr. Callum Bryce's tenure as trauma director. Mara was 36, medium build, dark hair pulled back in a way that was functional rather than tidy. She had the kind of face that people forgot in hallways, not because it was plain, but because she kept it deliberately neutral, the way someone learns to when they've spent years in environments where showing too much emotion is a liability. She'd been a floor nurse at Harlow Ridge for 4 years. Before that, she'd been somewhere else entirely, doing something the hospital's HR file didn't come close to describing. Her file said, "Prior employment, U.S. Army, 8 years, honorable discharge. Medical specialty, combat trauma." What the file didn't say was that she'd spent most of those 8 years embedded with special operations units in 3 different theaters, that she'd twice been the only medically trained person on the ground when things went catastrophically wrong, and that 2 of the commendations buried in a footlocker under her apartment bed had the word valor printed on them in gold ink. She'd left all of that behind on purpose. Harlow Ridge, Montana. Population 63,000. 1 level 2 trauma center. Quiet enough. That had been the plan. The plan was currently ending. Voss? The charge nurse, a heavy-set man named Darnell Okafor, caught her in the hallway between Bay 3 and the supply alcove. He was holding a clipboard and wearing the expression of someone who'd been handed bad news and told to deliver it personally. "Bryce wants to see you. Administrative. Now." "I've got a post-surgical observation in Bay 3. "Lena's got it. He said now, Mara." She looked at him for a moment. Darnell had been at Harlow Ridge for 11 years. He knew how to read a room, and he knew how to protect his people when he could. Right now, he wasn't meeting her eyes, which told her this wasn't a conversation she was going to win. "Give me 2 minutes," she said. She went into Bay 3, checked on her patient, 71-year-old Howard Fisk, recovering from an appendectomy, stable, grumbling about the IV placement, handed off the chart to Lena Park with specific instructions about his fluid balance, and then walked to the administrative corridor. Dr. Callum Bryce was standing behind his desk when she entered. He was 52, silver-haired, the kind of handsome that photographed well for hospital fundraiser brochures. He had a wall of credentials and the particular confidence of a man who had never been seriously wrong about anything, or at least had never been made to feel it. He was not alone. Helen Marsh, the HR director, sat in the chair to his right with a manila folder on her lap and the careful blankness of someone doing a job they'd decided not to feel. "Close the door," Bryce said. Mara closed it. "Sit down." "I'll stand." Bryce's jaw tightened slightly. That was new. Most of his staff sat when he told them to sit. He let it pass. "I want to talk about what happened in the trauma bay at 8:14 this evening." "The Greer case," Mara said. "The Greer case." He folded his hands on the desk. "The patient presented with blunt force thoracic trauma from a vehicle collision. I made a clinical assessment. I ordered imaging. I outlined a treatment protocol. You chose to question that protocol in front of 2 residents, an attending, and the patient's family members who were standing 3 feet away. You were going to wait 40 minutes for a CT before starting a chest decompression. I was following a diagnostic sequence. His trachea was deviated. His breath sounds were absent on the left. He had distended neck veins. She said it quietly, the way she said most things, but without backing up. That's a tension pneumothorax, Dr. Bryce. The CT was going to show you what I already knew by looking at him. Bryce's voice dropped a register. You do not override my clinical decisions in the trauma bay. I wasn't overriding. I was flagging. You grabbed a needle decompression kit. I had it in my hand. I didn't use it without your order. You were prepared to. She didn't answer that, because the honest answer was yes, and they both knew it, and saying it out loud wouldn't help either of them. Glenn Greer is alive, she said instead. His pressure stabilized 8 minutes after the decompression. The CT confirmed tension pneumo. That is not the point. It's the only point that matters to me. The room was quiet for a moment. Helen Marsh turned a page in her folder without looking up. Bryce leaned back in his chair. You've been a consistent source of friction since I came on board. You question protocols. You second-guess attending physicians. You undermine the authority of trauma leadership in front of junior staff. He paused. That's a pattern, Nurse Voss, and patterns have consequences. Am I being disciplined? He glanced at Helen. She slid a sheet from the folder and placed it on the desk, turning it to face Mara. It was a termination notice. Effective end of shift, midnight tonight. Mara looked at the document for a moment. She didn't reach for it. On what grounds? She said. Insubordination and conduct detrimental to the functioning of the department. Glenn Greer would be dead. That is a matter of clinical interpretation. No, she said, it isn't. But she picked up the document. She read it. It was real. It was signed, and it had Helen Marsh's tidy initials at the bottom. She set it back down. I'll need until end of shift to hand off my patients properly. Of course, Bryce said. He almost sounded magnanimous about it. She left without another word. The next 2 hours and 40 minutes were the most professional Mara Voss had ever been, which was saying something. She moved through her remaining patients with the same steadiness she always brought to a shift, except that tonight she documented everything with extra precision. Every assessment, every handoff note, every medication timestamp. Not because she thought it would change anything, because it was the right way to leave. She'd learned that in the Army. You don't leave a position dirty. You leave it cleaner than you found it, and you let the next person in know exactly where things stand. Lena Park figured out something was wrong around 10:30. She cornered Mara by the medication cart. Darnell's acting weird. What happened? I'm off the schedule as of midnight. Lena stared at her. Bryce fired you? HR processed it. Bryce signed it. Because of the Greer case? Lena's voice had gone tight. Mara, that man would be in a body bag. Keep it down. You saved his life. I know. She handed Lena a medication reconciliation sheet. Make sure Fisk in Bay 3 gets his potassium at 2 a.m. He's going to argue with you about it. Tell him his cardiologist ordered it, and it's not optional. Lena took the sheet but didn't move. You're not going to fight this? Mara considered how to answer that. The honest version was complicated. She'd spent years in places where fighting the wrong battle at the wrong time got people killed. She knew how to pick a moment, and this wasn't it. She also knew she was tired. Not just tonight tired, but deep tired. The kind that had been building since she'd left the Army and discovered that civilian medicine had its own version of the same problems, just with worse coffee and better lighting. I'll figure it out, she said. It wasn't a lie. It wasn't exactly the truth either. At 11:52, Mara cleared out her locker. It didn't take long. She'd never been a personalizer of workspace. There was a change of clothes, a paperback she hadn't finished, a tube of hand cream, and a photo of her and her younger brother taken at his college graduation 4 years ago. She put everything in a canvas tote bag, closed the locker for the last time, and stood in the empty locker room for about 15 seconds. Then she picked up the bag and walked toward the exit. She almost made it. The ambulance bay doors blew open at 11:57. Two paramedics she didn't recognize came through fast, too fast, moving with the focused urgency that meant something was genuinely bad rather than just busy. They had a gurney between them, and they were calling out to the triage desk before they were fully through the door. Male, 34, vehicle collision on Route 9, blunt abdominal trauma, BP's been dropping since pickup, heart rate 118. Mara stopped walking. She was 10 feet from the exit. Her bag was in her hand. She was technically no longer an employee of Harlow Ridge Regional Medical Center. She looked at the gurney. The man on it was big, well-built, the kind of lean muscle that came from discipline rather than a gym membership. He was pale in a way that wasn't just the overhead lights, and he had a rigidity in his abdomen, even through the trauma dressing, that made something in Mara's chest go very, very still. She recognized the look. She'd seen it in places where the nearest OR was a helicopter ride away, and sometimes the helicopter didn't come. It was the look of internal hemorrhage, the specific, particular look of a body trying to compensate for blood it was rapidly losing somewhere the paramedics hadn't found yet. The attending on duty was Dr. Finola Reeves, a competent emergency medicine physician who was already moving toward the gurney. Bryce was across the department. She could see him through the bay window, finishing some paperwork. Mara stayed where she was. Not your patient, not your shift, not your hospital anymore. The gurney passed within 4 feet of her, and she saw the man's face, eyes half open, the unfocused quality of someone whose body was in shock. And she saw something else too, a small, faded tattoo on the inside of his left wrist. 3 lines. A particular configuration that meant exactly nothing to someone who hadn't spent time in certain company, in certain places, doing certain things. Mara had spent that time. She set down her bag. "What's his pressure?" she said. Reeves looked up, startled. "Voss? I thought you were—" "What's his pressure?" 82/50, dropping. "We're getting a trauma panel. He's got abdominal compartment syndrome developing. You need a fast exam now, not after the panel." Mara was already at the gurney, her hands on the patient's abdomen with a clinical precision that bypassed the social awkwardness of the moment entirely. The rigidity was there, pronounced, worse on the right side. "Do you have the ultrasound?" "Voss, you've been—" "I know what I've been. Do you have the ultrasound?" Reeves looked at her for a fraction of a second. Something passed between them. The particular calculation of a physician facing a deteriorating patient and a person who clearly knew what they were looking at. "Get the portable," Reeves said to the tech behind her. The portable ultrasound arrived in 40 seconds. Mara ran the probe over the patient's abdomen with the economy of motion that came from having done this in the backs of vehicles, on rooftops, in conditions where every second burned. The image came up gray and unmistakable. Free fluid in Morrison's pouch, and the splenorenal space. His spleen's lacerated, grade 3, maybe 4. He's bleeding into his peritoneum. She looked at Reeves. "He needs IR or surgery, not imaging." "His ID says David Lorne. No next of kin listed. No, that doesn't matter right now. What matters is stopping the bleed." Reeves was already on the phone with the surgical resident on call. Mara stepped back because that was the line. She'd seen it. She'd flagged it. She'd given them what they needed. What happened next was on the physicians. She started to move back toward her bag. "Voss?" It was Reeves, hand over the phone. "Stay until we get him stabilized?" Mara looked at her. Then she looked toward Bryce's office. Through the window, she could see that Bryce had looked up from his desk and was watching the trauma bay with the expression of a man who had just noticed something that irritated him. "Off the clock," Mara said. "Not on a chart. I'm just standing here." "Fine," Reeves said. "Just stand there then." The next 40 minutes were controlled chaos of the productive kind, the kind Mara had been part of hundreds of times, enough times that her body moved through it almost without thought. She didn't take any formal role. She stood to the side and fed information when asked. Blood pressure trends, fluid response, the specific sequencing of interventions that she'd seen work in similar presentations. The surgical resident, a sharp second year named Tomas Abubakar, listened to her without asking why a terminated nurse was standing in his trauma bay at midnight offering guidance, probably because he was too busy keeping the patient alive to care about the organizational politics. David Lorne, if that was actually his name, went to interventional radiology at 12:31 a.m. with a blood pressure that had climbed back to 104/70 and a surgical team already briefed and waiting. Mara picked up her bag. She walked out of the ambulance bay into the rain. She was in the parking lot, keys in hand, when the first black SUV pulled in. She didn't register it immediately. It was after midnight. She was exhausted in ways that went past physical, and she was mentally composing the text she was going to send her brother about the job situation. The SUV pulled up fast and stopped at an angle that was just slightly too deliberate to be normal civilian parking, and a second one pulled in behind it, and then a third. Mara stopped walking. The vehicles were identical, dark, American-made, no plates she could see in the rain, and the poor light of the parking lot. The men who got out were not identical to each other, but they moved with a similarity that had nothing to do with physical resemblance. It was a discipline of movement, an economy, the kind that didn't come from a police academy or a security training course. She counted 6 of them. They were moving toward the hospital entrance, not toward her, which was why she was still standing in the rain watching rather than doing something more sensible. One of them, tall, close-cropped gray at the temples, the bearing of a man accustomed to being the one other people looked at for direction, paused at the entrance and said something to the man beside him. The second man turned and scanned the parking lot. His eyes found her. He said something to the first man. The first man turned. Even across 40 feet of wet asphalt in poor lighting, Mara felt the moment of recognition, not from her end, but from his. He was looking at her the way people looked at someone they'd been briefed on, like he had a photograph somewhere and had just confirmed the match. He changed direction and walked toward her. The other 5 adjusted and followed, which meant that 6 men in the rain were now crossing a parking lot toward a woman with a canvas tote bag, and any reasonable person would have found that alarming. Mara stood still. She'd spent enough time in environments where running from the wrong people was worse than standing your ground to know that this was a standing your ground moment. The man with the gray temples stopped 3 feet in front of her. "Mara Voss," he said. Not a question. "Depends on who's asking," she said. "Commander Dale Sutter, SEAL Team 8. He didn't show a credential. He said it the way people said things that they considered self-evident. "The man they just brought to your ER. We need to know his condition, and we need to speak with the medical personnel who assessed him." Mara looked at him steadily. "You should talk to the attending physician, Dr. Reeves." "We will." Sutter's voice was measured, careful. "We were also told that another nurse, someone who had already been relieved of duty, stepped in and identified a hemorrhagic condition that the primary team had initially missed." He paused. "I was told she had a tattoo recognition for an asset identification mark." The rain fell between them. "The man on that gurney," Mara said carefully, "had a wrist tattoo." "He did. 3 parallel lines angled at 12 degrees. Sutter's expression didn't change, but something in the set of his jaw did. "Where did you learn to read that marking?" 3rd Special Forces Group," she said. "Forward Operating Base Delmont, 2013 to 2015. We ran a joint rotation with Naval Special Warfare." Sutter was quiet for a moment. Then he said, "What was the surgeon's name on your team?" "We didn't have a surgeon. We had me." She held his gaze. "Lieutenant Mara Voss, 68th Medical Brigade, Special Operations Support. Until I wasn't." Something changed in Commander Sutter's posture, not dramatically, not the way it would happen in a film, but a real physical shift, a kind of recalibration. "You were attached to JSOC rotations," he said. "I can't confirm the specifics." "No," he agreed. "You can't." He looked at her for another moment. "The man on that gurney, his operational name is Ridgeback. He's been embedded in a civilian cover identity for 14 months. His actual name isn't David Lorne." "I didn't think it was." "He's one of mine." Sutter said it without inflection, the way operators talked about their people when they were trying to keep the emotion out of a tactical conversation. "If what I was told is accurate, you kept him alive long enough to get him to surgery. Dr. Reeves ran the stabilization. I provided information." "That's not what I was told." Mara shifted the bag on her shoulder. The rain was getting heavier. "Why are you in that parking lot and not inside, Commander?" "Because I wanted to find you before anyone else did." He said it simply, including Dr. Callum Bryce. She went still. Sutter watched her. We know about the termination. We know about the Greer case. And before tonight is over, we're going to know a lot more. He glanced toward the hospital entrance. One of my people is already pulling security footage from the ER systems. We have federal authority to do that when a classified asset is involved. You're going to audit the trauma department, Mara said slowly. We're going to do what we need to do to understand how one of my operators ended up in an ER where the attending nurse who correctly identified his injuries was being walked out the door at the same time. He paused. I'd consider it a professional courtesy if you didn't leave the area tonight. I live 8 minutes from here. Good. He handed her a card, plain white, just a phone number. If anyone from hospital administration contacts you tonight, call that number first. Mara took the card. She looked at it. She looked at him. He's going to be okay, she said. Your man. The grade of the laceration was manageable. The team was good. Sutter held her gaze. Because you gave them the right information. She didn't argue with that. He stepped back. The other 5 men adjusted again, the subtle reorganization of people who moved as a unit. They turned toward the hospital entrance. Mara stood in the rain with a canvas tote bag and a business card, and the first clear sense in a very long time that the quiet she'd been maintaining, the deliberate, careful quiet of someone who'd spent years trying to be ordinary, was about to become impossible to hold. Inside the hospital, through the glass of the ambulance bay doors, she could see Callum Bryce walking toward the administrative corridor with the unhurried confidence of a man who believed the night had gone his way. He hadn't seen the SUVs yet. He hadn't seen anything yet. Mara stood in the rain a moment longer. Then she took out her phone and sent her brother the text she'd been composing. Something came up. Call you tomorrow. She put the phone in her pocket. She looked at the card in her hand, then at the hospital entrance, then at the sky. Low, gray, rain coming down in steady, silver lines over the lights of the parking lot. She put the card in her jacket pocket. She did not get in her car. She walked back toward the hospital entrance, and when the automatic doors slid open and the fluorescent light of the ER hit her face, Darnell Okafor looked up from the nurse's station with an expression that went from surprise to something complicated. Mara, he said, I thought you left. I came back, she said. Bryce is going to. 6 Navy SEALs just walked in behind me, she said quietly, and they didn't ask for Dr. Bryce. Darnell turned slowly to look toward the entrance. Commander Sutter and his team were coming through the doors, and every head in the waiting area was turning, and the ER, which had been running at its usual midnight hum of controlled disorder, went very, very quiet. In the corridor outside his office, Dr. Callum Bryce stopped walking. The man leading the group, Commander Sutter, gray at the temples, carrying himself like a door that doesn't move, looked past Bryce, past the triage desk, past the admitting nurses, and found Mara standing at the nurse's station. He gave a single, small nod, and every SEAL in the room straightened. The nod was small. The silence that followed it was not. It spread through the ER the way silence always did in rooms where something was about to change, starting at the center and moving outward, catching each person in sequence. The triage nurses, the overnight resident, the 2 paramedics who'd brought in the next patient and were now standing by the doors with their mouths slightly open. Even the waiting room went quiet, the coughing man in the corner and the mother with the toddler on her lap and the teenager with his arm in a makeshift sling all going still at the same moment, responding to something they couldn't name but could absolutely feel. Commander Sutter walked to the nurse's station. He didn't rush. He moved the way he'd moved in the parking lot, like a man who had calculated every option in the room before entering it. I need the attending on the David Lorne admission, he said to Darnell. His voice was pitched for the station, not the whole department, but in the current silence, it carried anyway. Darnell looked at Mara. Mara looked at Sutter. Dr. Reeves is with another patient, Darnell said carefully. I can page her. Do that. Dr. Callum Bryce had not moved from his position in the corridor. He was watching the group at the nurse's station with the expression of a man trying to determine whether what he was seeing was a problem or an inconvenience. He'd built a career on being able to tell the difference, and right now the signals were mixing in ways he didn't like. He straightened his coat and walked over. Commander, he said, inserting himself into the space beside Darnell with the practiced ease of a man accustomed to owning rooms. He extended his hand. Callum Bryce, trauma director. I understand you're here regarding our recent admission. We'll get to you, Sutter said. Not rudely, just factually, the way someone declines a menu item they didn't order. Bryce's hand stayed out for a beat too long. He withdrew it. I'm the department chief, he said. Any conversations about patients in my trauma bay are covered under federal authority when a classified asset is involved. Sutter looked at him directly for the first time. We'll get to you, he said again. Same tone, same finality. Something moved across Bryce's face, a compression of the features, brief and controlled. He stepped back a half step and chose to interpret the moment as a temporary procedural inconvenience rather than what it actually was, which was someone telling him without particular warmth that he was not the most important person in this room. Mara watched him make that calculation. She'd seen it before. Men like Bryce were very good at reclassifying threats as slights and slights as misunderstandings, because the alternative, that someone had the authority to look past them entirely, was not a category their self-image had room for. Dr. Reeves appeared from Bay 4, still pulling off a glove. She was 41, compact, with the perpetual mild exhaustion of an emergency physician working a Montana ER at midnight. She took in the 6 men at the station and adjusted her posture without showing much on her face. Dr. Reeves, Sutter said. Yes. The man you admitted under the name David Lorne, what's his current status? Interventional radiology. They're controlling the splenic bleed endovascularly. He should avoid open surgery if the embolization holds. She paused. Who are you? Commander Dale Sutter. He's one of mine. Reeves absorbed this. He presented as a civilian MVA. He was in cover. He wasn't supposed to be on that road at that time. We're still establishing what happened. Sutter glanced at the agent to his left, a younger man with close-cropped hair who'd been making quiet notes on a handheld device since they came through the door. I need everything from the moment of admission. Paramedic report, triage notes, assessment records, interventions. I can pull his chart. We'll need the physical chart and the system records. And I need to know about the assessment that flagged the internal hemorrhage before your team ran full diagnostics. Reeves looked at Mara. Sutter followed her gaze. She's already spoken to us, he said. I want your account. Reeves chose her words with the deliberateness of a physician who had given enough legal testimony to know which ones mattered. The patient came in with vital signs consistent with shock. I was initiating a standard trauma protocol. A colleague who was, she paused, who was present in the department identified specific physical signs indicating active intraperitoneal hemorrhage and recommended immediate bedside ultrasound rather than waiting for CT imaging. What signs? Abdominal rigidity, right-sided predominance. She also noted a vasovagal response pattern consistent with volume depletion that was more pronounced than the BP readings initially suggested. Reeves hesitated. The ultrasound confirmed free fluid in the peritoneum. Without the ultrasound at that point in the timeline, we would have proceeded with imaging, and he would have been in the scanner when he decompensated. Time estimate on that decompensation? 12 to 18 minutes, Reeves said, maybe less. His pressure was trending fast. Sutter nodded slowly. He looked at Mara, and again the look wasn't readable in any simple way. It wasn't gratitude, wasn't admiration, was something more operational than either of those. Recognition was the closest word, but even that didn't quite fit. It was the look of someone confirming that a thing they'd been told was true had turned out to actually be true, which was not as common an experience as it ought to be. Thank you, doctor, he said. He turned to the young agent with the device. Get the full chain of records. I want timestamps on every intervention from admission through current status. Then to Darnell. I'll need a conference room and access to your security system administrator. That's, Bryce started. A federal matter, Sutter said. Still the same register, still not loud. We can do this cooperatively, or we can do it with paperwork. The paperwork takes longer and makes everybody's night harder. Bryce looked at him for a moment, and Mara could see him running the calculus. 6 federal operators in his ER at midnight, a classified patient in his IR suite, and a woman he'd just fired standing 6 feet away watching him decide what to do. He was a smart man. He understood leverage when it was applied to him, even if he'd spent most of his career being the one applying it. "Darnell," he said, with a control that cost him something, "set them up in Conference Room B." Conference Room B was a beige rectangle with a folding table and chairs that had been purchased with a county budget in mind rather than comfort. Mara sat at the far end with a cup of coffee that Darnell had brought her without being asked, and she watched Commander Sutter's team move through the room with the efficiency of people who had done this kind of thing, the rapid establishment of an information hub in an unfamiliar space, many times in much harder conditions. Two of the operators had laptops open within 4 minutes of sitting down. The agent with the handheld was on a call, speaking quietly, feeding coordinates or case numbers or something similar to whoever was on the other end. Another had gone to find the hospital's IT security administrator and would return with him shortly, the IT administrator having been woken from sleep in his office down the hall, where he apparently caught naps during overnight coverage shifts. Sutter sat across from Mara. "Tell me about the tattoo," he said. "I already told you, Tom." "Tell me again, with more detail this time." She set down the coffee. 3 parallel lines at a 12-degree angle from the wrist crease, approximately 4 centimeters long, faded, at least 5 years old. She paused. JSOC, Joint Operations Maritime Element, used from 2011 through about 2016 for asset identification in civilian cover scenarios. Standard placement was the inner left wrist. I saw it on a briefing sheet during a rotation at FOB Delmont. She looked at him. "I know what it means because I was in rooms where it was discussed. I'm not an operative." "No," Sutter agreed. "You were the one who kept operatives alive when the operatives got hurt." He said it without particular inflection. "I know your record, Lieutenant Voss." "I haven't been Lieutenant Voss for a long time." "No, but you assessed a grade 3 to 4 splenic laceration in a trauma bay at midnight while simultaneously being terminated from your employment, and you did it correctly. So the rank might be historical, but the training is not." Mara didn't have an answer for that she wanted to say out loud. 68th Medical Brigade, Sutter said. "You were attached to JSOC rotations in 2012, 2014, and again in 2015. 3 overseas deployments. 2 of those had combat casualty events where you were the primary or only qualified medical responder on site. You pulled my file." "We pulled your file when the paramedics radioed in the description of the patient and the collision location. The location didn't match anything coincidental." He leaned forward slightly. "He wasn't in a vehicle accident. He was run off the road, deliberately. We think by someone who knew his approximate route, which means his cover may have been partially compromised." The room's background noise, keyboards, the quiet voice on the phone, the hum of the building's HVAC continued around them. Mara processed what he'd said. "Is that why you're pulling security footage?" she said. "You think whoever compromised his cover might have known he'd end up here?" "It's a possibility we have to rule out. That means you're also looking at hospital staff." Sutter didn't answer, which was its own answer. Mara thought about that for a moment. She thought about Bryce in his office, signing a termination notice. She thought about the medication reconciliation she'd done at midnight, and the chart notes she'd written with extra precision, and the specific, uncomfortable feeling she'd had all week that something in the department was wrong in a way she couldn't quite locate. "How long has your man been in this area?" she asked. "I can't share operational details." 14 months, she said. "You said that in the parking lot." Sutter looked at her steadily. "Yes." "And his cover was civilian, meaning he'd have had interactions with local institutions, medical, financial, administrative." "Yes." "Including possibly this hospital." A pause. "It's a line of inquiry. Because if someone on staff knew who he was..." She stopped, thought it through. "You're not just here about tonight." "No," Sutter said quietly. "We're not just here about tonight." The IT administrator's name was Pete Warden, and he was 61 years old and had been working hospital systems since the early days of electronic records, and had absolutely not expected his Thursday overnight shift to involve 6 men in dark clothes and a federal warrant for access to a decade of security camera archives. He was cooperative in the way that people were cooperative when the alternative was made clearly unappealing, and within 30 minutes he had the conference room connected to the hospital's security system with full administrative access. What the cameras showed in the first hour of review was routine ER footage, patients, staff, visitors, the mundane choreography of a medical facility at work. Then one of the operators found the footage from Bay 2 at 9:43 p.m. "Commander," he said. Sutter crossed the room and looked at the screen. Mara stayed where she was. She could see the monitor from her angle, but not the specific image detail. She watched Sutter's face instead. He had very good control of his expressions. She noticed him go still. "Back it up 30 seconds, he said. The operator backed it up. "Now forward at quarter speed." Mara stood and walked to the monitor. The footage showed Bay 2 from the ceiling camera, the wide-angle view that captured the whole room. The timestamp was 9:43 p.m., which meant this was during the period when David Lorne, the man with the tattoo, had first been admitted, before he'd been moved to interventional radiology, before Mara had even been called to Bryce's office. On screen, the patient was in the bay. He was unconscious. 2 nurses were doing a secondary assessment. A physician's white coat was visible at the periphery, but that wasn't what Sutter was looking at. He was looking at the right side of the frame, where a figure, only partially visible, cut off by the camera angle, had approached the medication access panel on the wall, the panel that held override accessible medications for trauma situations. The figure's face wasn't visible, but the figure's hands were, and the hands were doing something at the panel that had nothing to do with patient care. "Can you isolate the hand region?" Sutter asked. The operator zoomed. The image pixelated, then sharpened with the enhancement software. A hand, pressing a series of buttons on the panel keypad, not pulling medication out, entering a sequence into the panel's electronic ordering interface, the interface that connected directly to the pharmacy system. "What is that panel?" Sutter asked. Mara answered before anyone else could. "Automated dispensing cabinet, Pyxis system. You can enter medication orders through the bedside interface for emergency overrides. It bypasses standard pharmacy review for critical situations." She looked at the screen. Someone entered a medication order through that interface, for that patient. And it wasn't his attending physician, because Dr. Reeves was across the department at that time, and the nurses in the frame didn't enter any orders. So who did? "The person whose face we can't see," Mara said. Sutter looked at Pete Warden. "I need the Pyxis system logs for Bay 2 tonight, 7 p.m. to present. Every entry, every access, every badge scan." Warden was already pulling up the system. His hands were not entirely steady. The Pyxis log took 4 minutes to compile. When it came up, Sutter's operator cross-referenced the timestamp from the video, 9:43 p.m., against the access records. The Bay 2 panel had been accessed at 9:44 p.m. A medication order had been entered. The badge ID attached to the access was not a nurse's ID. It was not a pharmacist's ID. It was not an orderly or a technician or anyone whose role would involve that panel at that hour. It was a physician's badge. It was Dr. Callum Bryce's badge. The room went very quiet. Mara looked at the access record and felt something cold settle into her chest. Not surprise exactly, but the particular discomfort of a suspicion you'd been carrying without naming it finally acquiring a concrete shape. "What was the order?" Sutter said. The operator pulled the pharmacy record attached to the access code. Potassium chloride. 7 milliequivalents per hour, IV push. Mara's mouth went dry. IV push potassium chloride at that concentration in a hemodynamically unstable patient was not a treatment. It was not an emergency intervention. It was not within any protocol she had ever read or been trained on or seen applied in any legitimate clinical context. It would stop a heart. "Was this order administered?" Sutter said. Warden checked. His voice was barely above a whisper when he answered. The Pyxis dispensed the medication at 9:45 p.m. Bay 2. He looked up. His face had gone the color of old chalk. But the patient was transferred to IR at 10:20. He scrolled. The medication was signed as administered at 10:08. By who? Badge ID 4471. He looked at the staff roster. That's... He stopped. Say it, Sutter said. That's Nurse J. Holt. She's on tonight. She's currently on the floor. Mara was already at the door. Swat. Janet Holt had been at Harlow Ridge for 7 years. She was 44, efficient, well-regarded on the overnight floor. Not one of the trauma team regulars, but frequently pulled to cover gaps in different departments. She was not someone Mara had ever thought twice about. She was the kind of person who existed at the edges of awareness in any institution, competent, unobtrusive, reliably present. Mara found her in the supply corridor off the main floor, doing inventory counts with the methodical patience of someone who'd done it 1,000 times. She looked up when Mara came in. Mara, a pause. I heard you were Bay 2, Mara said. Tonight, 9:44. Something happened in Janet Holt's eyes. It was small and quick and might have been invisible to someone who wasn't looking for it. But Mara had spent 8 years in environments where the difference between a person telling the truth and a person constructing a story was the single most important clinical assessment she could make, because one of those scenarios sometimes meant someone was about to do something dangerous. I cover a lot of bays, Janet said. It's been a busy... The Pyxis in Bay 2 has your badge on a medication administration record. Potassium chloride. IV push. Mara kept her voice level. For the patient in Bay 2. Janet was quiet. He's in IR right now, Mara said. They found the splenic bleed. They're controlling it. But if that potassium had been pushed at that concentration into that line before the transfer, it wasn't, Janet started. Your badge says it was. I didn't give that order. Janet's voice had shifted, not defensive, something more complicated. Afraid, but not in the way Mara expected. Not the fear of being caught. A different kind. I didn't enter that order. I signed it off because I was told it was a correction to an earlier order. I was told by... She stopped. By who? Janet looked at the supply shelves. Her hands were still, the clipboard held in both of them like something to hold on to. I want to talk to someone, she said. Not you. Someone with authority. There are 6 federal operators 40 feet down that hallway, Mara said. I can take you to them right now. Janet Holt looked at her for a long moment. Something shifted. The particular shift of a person who has been carrying something alone and is realizing the weight of it has finally become more than the cost of putting it down. He told me it was a potassium correction, she said quietly. He showed me the original order and said the dose had been entered incorrectly in the system and needed a corrective administration to rebalance the patient's electrolytes. Her voice was flat with the rehearsed quality of something she'd been telling herself. He had the chart. It looked like a legitimate correction. Who showed you the chart? Janet looked at her. Who? Mara said. The supply room was very quiet. Outside in the hallway, somewhere distant, a monitor was alarming, the routine, rhythmic alarm of equipment requesting attention, the kind that staff learned to categorize on hearing. That one's fine, that one needs a check, that one needs to run. Janet Holt opened her mouth. And in conference room B, 40 feet down the corridor, the operator running the Pyxis log cross-referenced a second record that hadn't come up in the initial pull, a system access at 11:03 p.m., a full hour after the first, using the same physician's badge, entering a second medication order for the patient in IR Suite 1. A second order. Because the first hadn't worked. Because David Lorne, against every calculation that had been made about him that night, was still alive. The operator looked at the second order in the system and said, very quietly, Commander, you need to see this. Sutter was already moving. He crossed the conference room in 4 strides and looked at the screen, and Mara came through the door 30 seconds later with Janet Holt 2 steps behind her, and the room absorbed all of it, the second medication order on the monitor, the 2 women in the doorway, the particular quality of stillness that had settled over Sutter's team in the way that stillness settled over people who had been trained to respond to danger by going quieter rather than louder. The second order was on screen. Potassium chloride, 12 milliequivalents, IV push, entered at 11:03 p.m. into the pharmacy system for the patient currently in IR Suite 1. Same badge, same physician ID. Entered an hour after the first order when the patient had already been transferred out of the trauma bay and was in the process of having his splenic hemorrhage controlled by a team of people who had no idea a lethal medication order had been queued into his active record. "Is this order flagged in the IR suite system?" Sutter said. The operator checked. "It shows as pending. It hasn't been administered." "Cancel it right now and flag the patient's entire medication record for secondary authorization on every entry going forward. Nothing gets pushed without a second physician sign-off." "I need administrator access for that override," the operator said, looking at Pete Warden. Warden was already at the keyboard. Sutter turned to Mara. "The IR team. Are they aware of the first order?" "No," Mara said. "The first administration was documented as completed before his transfer. The IR team received a standard handoff. They wouldn't have been flagged for a prior potassium push, unless it showed a cardiac abnormality on the monitor, which," she stopped, ran the timeline in her head. "If the first dose went in at 10:08 and his transfer was 10:20, he'd have been on continuous cardiac monitoring from 10:15 onward. A potassium push at that concentration in a volume-depleted patient should have shown changes within how long? 8 to 12 minutes, maybe faster, given his hemodynamic state." She looked at the screen. "But it didn't. Which means either the dose was diluted in transit or it didn't go in," said Janet Holt from the doorway. Everyone looked at her. She was holding the clipboard in front of her like a small shield, and she was pale in the way that people went pale when they were past the point of deciding and into the point of living with the decision. "I signed the administration record," she said, "but I didn't give it. She exhaled. "I drew it up. I had the syringe. And then I looked at him. His pressure was already so low, and I looked at the order and I thought about the potassium level on his panel, and it didn't add up. A correction for potassium deficit doesn't look like that. It doesn't get pushed." She pressed her lips together. "I disposed of it. In the sharps. And I documented it as administered because I didn't know what else to do, and I was..." Her voice broke slightly, then steadied. "I was scared." The room was quiet. "Who told you to give the order?" Sutter said. Janet looked at the floor, then she looked up. "Dr. Bryce," she said. "He came to Bay 2 at 9:50. He showed me the tablet with the order, said the admitting resident had entered the wrong potassium value and it needed to be corrected before the transfer. He said he'd already called pharmacy, but the fastest route was the Pyxis override." She paused. "He's done things like that before. Gone around the standard process when he said it was time-sensitive. I didn't have a reason to question him," Mara said. Janet looked at her. "No." Mara understood that. She understood it in the specific bone-level way of someone who had spent 4 years watching people not question Callum Bryce because he occupied a category in the institutional hierarchy where questions were treated as insubordination rather than competence. She'd been the anomaly. She'd questioned him and been handed a termination notice for it. Most people made the more rational choice. "You're going to need to give a full statement," Sutter said to Janet. "Tonight. Here." He looked at his agent. "Get a recorder. And get somebody on the phone who can formalize this." He looked back at Janet. "You're not in trouble for not administering the drug. But I need everything you know, in order, starting with the first time Bryce asked you to do something that felt wrong." Janet nodded. She was trembling slightly, not dramatically, just the fine motor tremor of someone who had been holding a very large secret in a very small space for longer than was good for them. Sutter touched the arm of the operator nearest him. "Find Bryce. Don't approach him. Just locate him and maintain visual." The operator left the room. Sutter looked at Mara. "The second order in the IR system, you said it should have caused cardiac changes if administered. What kind of changes?" "Peak T waves first, then widening QRS. Then, if it wasn't caught, ventricular fibrillation." She said it clinically because that was the only way to say it in a room full of people trying to make fast decisions. It would have looked like a cardiac event in a trauma patient, not uncommon, not automatically suspicious in a man with his injury profile. "It would have looked like he died from his injuries," Sutter said. "Yes, he absorbed that. And the first order, if Holt had administered it," Same outcome, faster maybe, because he was more hemodynamically compromised at that point. Sutter turned back to the screens. So we have 2 attempts. First attempt in the trauma bay, not administered. Second attempt in the pharmacy system, not yet administered. He said it with the flat precision of a man building a sequential account. Between those 2 attempts, what happened? Mara knew what happened between them. She'd been the thing that happened between them. She'd flagged the internal hemorrhage. She'd pushed for the fast ultrasound. She'd kept the team focused on stabilizing him for transfer instead of waiting for imaging, which meant he'd moved through the department faster than anticipated, which meant the window for the first medication attempt had closed before anyone could act on it. And then in IR, with a controlled environment and continuous monitoring, a second attempt had been queued but not yet executed. She didn't say any of that. Sutter was smart enough to have already worked it out. He's still trying, Sutter said. It wasn't a question. The second order is still in the system as pending, the operator at the keyboard said. Cancelled now, but it was active for... He checked. 47 minutes before we pulled it. 47 minutes during which anyone with the access code could have administered it, Mara said. Who has access to the IR suite, Sutter said. Any physician with admitting privileges. Nurses assigned to the suite. The IR team itself. She paused. Department chiefs have blanket access. Sutter looked at the operator who'd gone to find Bryce. His radio crackled. Commander, subject is in the east corridor, moving toward the IR suite. The room went very still. Sutter was through the door before Mara had finished processing the words. The east corridor at Harlow Ridge connected the main ER block to the imaging and interventional suites through a passage that was wide enough for a gurney and lit with the particular institutional brightness of fluorescent panels that never quite dimmed. It smelled like floor cleaner and recycled air, and at 12:47 in the morning, it was empty except for a transport aide pushing an empty wheelchair in the opposite direction, and 30 feet ahead of Commander Sutter and his 2 operators, Dr. Callum Bryce. Bryce was walking at a normal pace. He had his white coat on and his ID badge clipped to his lapel and a tablet in his hand that he was looking at, which was completely unremarkable. A physician reviewing records on his way to check on a patient. Every element of the picture was normal. That was the thing about it that was not normal at all. Dr. Bryce, Sutter said. Bryce stopped, turned. His face went through a sequence of adjustments so fast they were almost invisible. Surprise, calculation, controlled neutrality, and landed on the expression he'd used in the ER. The careful patience of a man dealing with an inconvenience. Commander, he said, I was just checking on the admission from tonight. I know where you're going, Sutter said. Step back from the suite entrance. I'm the trauma director. I have every right. Step back, Sutter said. His voice had dropped a register. Not threatening, something flatter than threatening, more certain. The voice of a man who had spent decades in situations where the next sentence determined whether things stayed manageable or became something else entirely. Bryce looked at him. He looked at the 2 operators flanking Sutter. He did the math that men in his position always did, the calculation of what he could still control. He took a step back. I want to know, Bryce said, and his voice was very level. What exactly you think you're doing? Right now, I'm preventing you from accessing a patient whose medication record you've already altered twice tonight. Sutter held his gaze. We have the Pyxis logs. We have the system access timestamps. We have the pharmacy record for both orders. He paused. And we have a witness. Something happened in Bryce's face. The controlled neutrality cracked. Not into anger, not into fear exactly, but into something underneath both of those, something raw. He recovered it in about 2 seconds. Whatever you think you found, he said, you need to understand the context. I understand the context clearly, Sutter said. You entered a lethal medication order for a classified federal asset under civilian cover. You had a staff member sign off on the administration of that order. When the first attempt failed because the staff member didn't administer the drug, you entered a second order in the IR system. He said it sequentially, without emphasis, the way someone reads a list of facts. That's 2 attempts on a federal agent's life, tonight, in your hospital. Bryce's jaw tightened. That's an extraordinary accusation. It's an ordinary evidence chain. Bryce was quiet for a moment. He looked at the tablet in his hand. He looked at the corridor. The transport aide had disappeared around the corner. They were alone in the East Passage. And then he looked at Sutter with an expression that Mara, who had come into the corridor from the conference room side and was standing 10 feet behind Sutter, recognized as the specific look of a man deciding which version of the next 30 seconds was most survivable. I want a lawyer, Bryce said. That's a reasonable request, Sutter said. You'll have that opportunity. He looked at the operator to his left. Stay with him. Then he turned and saw Mara. Is the patient secure? He said. I called down to IR, she said. Dr. Reeves is coordinating. They've got him on a clean record. Monitoring's been confirmed. Second physician is on site. She paused. He's stable. Procedure went well. Sutter nodded once. He looked tired in the specific way that people look tired when the immediate crisis had resolved and the weight of the surrounding circumstances was settling back in. He'd been running on operational adrenaline for the last hour and a half, and it showed in the set of his shoulders. Good, he said. Behind him, Bryce stood in the corridor with the SEAL operator at his shoulder, and he was very still, and whatever was going through his head was not visible on his face anymore. He'd put the controlled neutrality back on like armor. People like Bryce were good at armor. They'd spent careers building it. But armor, Mara had learned, was only as good as the structural integrity of what was underneath it. And what was underneath Callum Bryce's was starting to show its fractures. What happened next took 3 hours and involved a sequence of people arriving at Harlow Ridge Regional Medical Center who had not been there at midnight and whose presence collectively shifted the atmosphere of the hospital from an acute clinical crisis to something that felt more like the careful procedural dismantling of something that had been built badly over a long period. 2 federal agents from the regional field office arrived at 2:15. They were not SEAL operators, they were investigators, and they moved differently, more methodical and less physical, and they set up in Conference Room B alongside Sutter's team and began the process of formalizing what the security footage and Pixis logs and Janet Holt's statement had already outlined. A hospital attorney arrived at 2:40 and spent 40 minutes in a side room that was not Conference Room B, which told Mara that the institution's response to what was happening was already bifurcating from whatever personal response Bryce might have, the hospital protecting itself, drawing lines, beginning the process of establishing that whatever Callum Bryce had done, it had done it without the knowledge or endorsement of the administration. Mara had complicated feelings about that. She sat in the break room off the main nursing corridor and drank a second cup of coffee and looked at the wall clock and thought about how institutions worked, which was a thing she'd thought about extensively during her time in the Army and had never fully resolved. Institutions protected themselves. That was their primary directive, more fundamental than any stated mission. Sometimes the self-protection aligned with the right thing. Sometimes it didn't. What you hoped for, and what you couldn't count on, was that when the external pressure was sufficient, the two things would point in the same direction long enough to produce a decent outcome. Lena Park found her at 3 a.m. They're bringing Bryce to Conference Room B, she said. She sat down across from Mara without asking. Darnell told me. The investigators want a formal interview before they... She stopped. Before whatever comes next. Okay, Mara said. Are you okay? I don't know yet. Lena looked at her with the particular directness of someone who had worked beside another person through enough bad shifts to have moved past the social layer of communication into something more efficient. You should have been here 4 years ago, she said, when he got here. When he started. What do you mean? I mean there were nurses before you who flagged things. Not like tonight. Nothing like tonight. But irregularities. Cases where the outcome was worse than it should have been, and Bryce signed off on it, and nobody looked too hard. She wrapped her hands around a mug that had gone cold. There was a complaint filed 18 months ago by 2 nurses in the cardiac step-down unit. Administration reviewed it, and she shrugged, a small, exhausted movement. Dr. Bryce was a high performer. His metrics were strong. Patient satisfaction scores, OR efficiency, trauma response times. She paused. Those things were real. He was genuinely good at parts of the job. Good surgeons can still kill people, Mara said. Yes. Lena looked at her hands. That nurse, Holt. She didn't administer it. I know, but she signed it. She was frightened, Mara said. She'd been in a system where questioning him had no outcome except professional damage, for long enough that it became the default. She heard herself saying it and understood she was also describing herself, or the version of herself that might have existed if she hadn't had the particular background she had. The background that made it possible to hold a needle decompression kit in a trauma bay and stand there, visible, daring someone to tell her she was wrong about a dying man's anatomy. Not everyone got that formation. Most people didn't. Most people were Janet Holt, trying to survive inside an institution that had made questioning the wrong person too costly to risk. The complaint from 18 months ago, Mara said. Who received it? Administration. Richard Pell. He's the COO. Lena looked at her steadily. It was reviewed and dismissed. Mara set down her coffee cup. Dismissed how? Filed, reviewed, closed. No action. Lena paused. Pell sent out a memo about improving communication protocols. That was the response. Mara thought about that for a moment. She thought about it with the particular attention she gave to things that mattered more than they initially appeared to. Has Pell been in the building tonight? She said. Lena looked at her. He came in around 2. He's been in his office since. Has anyone from Sutter's team talked to him? A pause. I don't know. Mara stood up. She found Sutter in the corridor outside Conference Room B, where Bryce was currently being formally interviewed by the 2 federal investigators. The door was closed. Sutter was standing outside it with a coffee of his own, which he had clearly just acquired from somewhere, and which appeared to be giving him only minimal comfort. The prior complaint, Mara said without preamble. 18 months ago, 2 nurses in cardiac step-down filed a formal complaint about patient care irregularities linked to Bryce. Administration reviewed and closed it with no action. Sutter looked at her. How do you know about that? Does it matter? Yes, he said. Everything's going to matter very precisely in about 2 hours when the documentation phase starts, and I need to know the chain of how information reached you. A colleague told me just now. She was on staff at the time. Mara kept her voice level. The COO, Richard Pell, received and closed that complaint. He's been in his office since approximately 2 a.m. tonight. I don't know if he's been interviewed. Sutter looked past her toward the administrative wing. He said nothing for a moment. Then he said, What's your read on him? I've met him twice. Hospital functions. He's good at functions. She chose her next words carefully. A closed complaint with no action, against a physician with strong metrics, and apparently some ability to operate outside normal oversight channels without getting caught. That complaint didn't close itself. No, Sutter said. It didn't. He handed his coffee to the operator near the door, an unconscious, reflexive transfer of an inconvenient object before moving, and took out his radio. The next 18 minutes were the most procedurally dense of a night that had already been procedurally overwhelming. Sutter made 3 calls. One of his agents went to the administrative wing. The 2 federal investigators were informed of the prior complaint record. Pete Warden, who had been running on anxiety and institutional self-preservation instincts since 2 a.m., was asked to pull the administrative email records for the complaint review process, which he did with the cooperation of a man who had correctly identified which side of the night's events he needed to be on. The email records came back in 22 minutes, and the email records showed something that the complaint review summary had not shown. A 3-message exchange between Richard Pell and Callum Bryce, dated 11 days after the complaint was filed and 1 week before it was officially closed, in which Bryce outlined the specific professional risks to both of them if the complaint led to a formal investigation, and in which Pell, in language carefully nonspecific enough to be deniable in isolation, confirmed that the matter would be handled internally. The language wasn't a confession. It was the kind of language people used when they were smart enough to know they were creating a record and wanted the record to be survivable if reviewed. But read in the context of everything else, the Pyxis logs, the security footage, Janet Holt's statement, the 2 medication orders for a classified federal patient, it read as something else. It read as the framework of a protection arrangement that had existed long before tonight and had been tested and until now had held. Mara read the printed summary the federal investigator handed her and felt the cold thing in her chest from earlier come back, harder this time. This wasn't just Bryce. It had never been just Bryce. At 4:17 a.m., Richard Pell was asked to come to conference room B. He came in with the composure of a man who had spent 2 hours in his office preparing for this possibility and had decided that his best approach was cooperation, framed as concern. He was 60, silver-haired, with the practiced sincerity of someone who had run enough difficult institutional conversations to know how to sound like he was on the right side of them. He lasted 11 minutes before the email records went on the table. Mara wasn't in the room. She was in the corridor, and she knew what was happening inside only by the way the two federal investigators' voices, audible as low tones through the door, shifted from the measured pace of procedural questioning into something shorter and more specific. She was standing there when Lena Park came down the corridor at a half-run. "Mara." Lena's voice had a quality to it that stopped everything else. "IR Suite 2. The patient." They called a rapid response. Mara was already moving before Lena finished the sentence. IR Suite 2 was 2 corridors and 1 elevator away, and Mara covered it in 90 seconds, which she would not have been able to do 4 years ago, and could do now only because 4 years of overnight ER shifts had given her an involuntary familiarity with every shortcut in the building. The rapid response team was already in the suite when she arrived. 5 people, the IR attending, 2 nurses, the overnight critical care fellow. The monitors were loud with the alarm she'd been dreading since she'd first seen the potassium entry in the Pyxis log. Peaked T waves on the cardiac monitor. QRS widening. The first order. Not the second. The first one. The one Janet Holt had said she disposed of, had documented as administered, but hadn't given. The one that shouldn't have been in his system. Except it was. The critical care fellow was calling out orders in the tight, controlled voice of someone managing a life-threatening electrolyte event: calcium gluconate, insulin and dextrose, sodium bicarbonate, continuous cardiac monitoring, standard hyperkalemia protocol. Right responses, right sequence. The team was good. Mara came to the glass partition and watched. She ran the math in her head, the math she'd been running since she first looked at that Pyxis log. If the first dose had been administered at 10:08, which was what the record said, and Janet claimed she hadn't given it, then either Janet was wrong or her disposal of the syringe had been incomplete, or there had been a third point of access that none of them had found yet. She looked at the monitors. She looked at the IV lines running into the patient. There were 2 lines. A peripheral IV in the left antecubital, placed in the trauma bay, placed in the Kärkdatsum, and a central line placed in IR, standard practice for hemodynamic monitoring during embolization procedures. 2 separate access points. She looked at the peripheral line. The saline bag hanging on the left side IV pole had a small secondary port at the Y junction where additional medications could be introduced. It was sealed. It looked sealed. She looked at it more carefully. The seal wasn't quite right. Not obviously wrong. Nothing that would read as suspicious on a quick check during a busy procedure. But the membrane had a specific reflectivity under fluorescent light when it had been recently pierced, a small distortion in the surface that was invisible unless you were looking for it and knew what the undisturbed version looked like. Mara pushed through the suite door. "Who accessed the peripheral line?" she said. The critical care fellow looked up. "What?" "The left antecubital, the Y port on the saline bag." She was at the IV pole. "Who accessed this line since the patient came into IR?" "We've been on the central line for the procedure. Someone accessed the peripheral port." She was looking at it closely now. The membrane, the faint, unmistakable distortion. Recently, in the last 2 hours. She looked at the team. Who was in this suite between 1 and 3 a.m.? The IR attending was a compact woman named Dr. Sylvie Orr, who had the tight focus of someone running a complex procedure in crisis mode and didn't appreciate the interruption, but was also, Mara could see, listening. "I was here continuously from 10:20 through 2:30, Orr said. "I handed off to the overnight fellow at 2:30. My nurses were here with me." "Who came in after 2:30? The overnight fellow, a young man named Marcus Webb, who looked approximately 26 years old and had the expression of someone experiencing a very bad night in their residency, said, "I had a consult at 3. I was out of the suite for maybe 15 minutes. Was anyone else in the building with admitting privileges who could have accessed this suite? Webb looked at her. He was putting it together. She could see it happening, the sequence of implications assembling themselves in his expression. During your consult, she said, between 3 and 3:15, was anyone else in this room? He looked at the monitors. He looked at the IV pole. He looked at Mara with the expression of someone who had just understood something terrible. There was a physician, he said. I assumed he was checking on the patient. He had an ID badge. He was in a white coat. I didn't think... Who? Mara said. Webb's voice came out thin. I don't know his name. I'd never seen him before. He was here when I came back. He said he was covering for the trauma director. Mara turned to look at the corridor through the suite's glass partition. The corridor was empty. Whoever had been in the suite between 3 and 3:15 was gone. They had been gone for over an hour. And the patient in IR Suite 2 was currently in a hyperkalemia event that the rapid response team was actively managing, and that had been caused not by the medication orders they'd found in the Pyxis system. Those had been canceled, those had been caught, but by something introduced directly into a peripheral IV line by a person in a white coat who Marcus Webb had never seen before, and who had disappeared into the overnight corridors of Harlow Ridge Regional without leaving anything behind. A second person. Bryce was in conference room B. Pell was in conference room B. Someone else was in the building. Mara was already at the door of the suite, already reaching for the radio that Sutter had put in her hand at some point in the previous 2 hours without either of them making a formal moment of it, and she keyed it and said his name, just his name, one word, and he came back immediately because men like Sutter slept lightly and responded fast. And she said, There's a second actor active in the building. He's already dosed the patient through the peripheral line. I need you in IR Suite 2 right now, and I need every exit in this building locked down before... The lights went out. Not a flicker. Not a brownout. The full overhead lighting in the IR corridor went out in the specific, total way that hospital lighting did not go out unless something structural had failed or someone had made it happen. And in the darkness, the only illumination was the cold blue glow of the monitors through the suite's glass partition and the emergency strips along the floor clicking on one by one in the backup sequence. And somewhere in the dark of the east corridor, a door banged open against a wall with the particular violence of someone moving fast and not caring who heard it. Mara didn't wait for Sutter to respond on the radio. She keyed it once more. East corridor, someone running, lights are out. And then she moved, because standing still in a dark hallway, waiting for someone else to make a decision, was not something her body knew how to do. The emergency floor strips were casting low amber light along the baseboards, enough to navigate by, not enough to see faces at any distance. She went into the corridor and stopped, listening. The door that had banged open was to her left, 20 feet. The stairwell. She could hear it still moving on its hinges, the slow drift of a heavy fire door that had been hit hard and was returning to center. She went to it and pushed through and heard footsteps above her, not below. Someone going up, not out. She went up. The stairwell was concrete and echo and the amber strips on each landing, and whoever was above her was moving fast but not silently, the footsteps of someone prioritizing speed over concealment. Second floor, third. The footsteps stopped. Third floor. Storage, administration, the records department, the COO's office at the far end of the east wing. Nobody had clinical reason to be on the third floor at 4:30 in the morning unless they were retrieving something, destroying something, or trying to reach a specific exit point that wasn't being watched. Mara pushed through the third floor stairwell door into a corridor that was darker than the floors below. Fewer emergency strips, longer gaps between them, and held still. Breathing. 40 feet ahead, off to the right. Someone trying to control their breathing and not entirely succeeding. She moved along the left wall, keeping her footsteps off the center of the corridor where the flooring was older vinyl that shifted under weight, sticking to the wall edge where it was solid. The administrative wing was ahead. The offices were dark, but one of them had a faint secondary glow, the standby light of a computer that hadn't been fully shut down, visible under the door gap. She stopped outside the door. She heard the specific sound of a keyboard, fast, not someone working, someone deleting. She opened the door. The man at the desk was not Bryce and was not Pell. He was 58 or so, compact, with a close-cropped beard, and the white coat of a physician that was slightly too large for him, and he was at Richard Pell's desk using Pell's logged-in computer terminal, and his hands were moving across the keyboard with the focus of someone who had a specific task and a tight timeline and was not expecting the door to open. He looked up. For 2 seconds, they looked at each other across the room. Then he shoved back from the desk, and the chair hit the credenza behind him with a crash, and he came up moving toward the other side of the room where a second door connected to the adjoining conference suite, and Mara stepped forward and put herself between him and it. "Don't," she said. He stopped. He was bigger than her, broader through the shoulders, had 4 inches on her. He looked at the door behind her and looked at her and did the same calculation that men in physically superior positions did when they were considering whether to move through a smaller person. She watched him do it. She held his gaze and said nothing more, because the thing she'd learned in the army, and the thing that held here too, was that the calculation in a person's eyes was its own communication, and the right response to it was not words. The right response was stillness that conveyed, without dramatizing, that the calculation had already been done and the answer was not in his favor. He didn't move through her. In the corridor behind Mara, boots on the stairwell, 2 sets, fast. The door opened. Sutter and one of his operators came through, and the operator had a flashlight up and sweeping, and it found the man at the desk inside the office within about 3 seconds. "Down," the operator said. "On your knees, hands where I can see them." The man knelt. He did it with the particular obedience of someone who understood the moment was over and had already started the next calculation, the one about lawyers and statements and how much of what was on that computer screen he'd managed to delete before the door opened. Sutter came to the doorway and looked at the terminal. The screen showed a file management window, a deletion progress bar that had stopped at 63% when the keyboard was abandoned. "Get that machine isolated," Sutter said to his operator. "Don't let it complete the deletion." The operator moved to the terminal. Sutter looked at the man on the floor. "Who are you?" he said. The man on the floor said nothing. "You were in IR Suite 2 between 3 and 3:15 a.m., Sutter said. "You accessed a patient's peripheral IV line. The patient is currently in a hyperkalemia event being managed by a critical care team. He crouched down to be at eye level, which was not an aggressive gesture, but was not a neutral one either. Who sent you here?" Silence. "The deletion is recoverable," Sutter said, gesturing at the terminal. "Whatever you were trying to remove, our people will have it within a few hours. What you do right now, whether you help us understand this or make us build the picture without you, is the only variable still in play for you tonight." He paused. "So I'll ask again. Who are you?" The man looked at the floor. He was breathing steadily, controlled, deliberate. He'd had training, not military, but something. The composure wasn't civilian. "I want immunity," he said. "That's not something I can offer you." "Then I don't have anything to say." Sutter stood. "Get him out of here," he said to the operator. He straightened and looked at Mara. "How's the patient?" "The rapid response team was on it when I left. They had the right protocol running." She paused. If they got to him fast enough, the calcium gluconate would have started buying time within a few minutes. The cardiac changes were early stage. Would he survive it? If the team is competent and nothing else goes wrong tonight, yes. She heard herself say it and recognized the conditional in it, the nothing else goes wrong, and knew they both recognized it too. Sutter looked at the terminal where his operator was working to halt the deletion process. Someone built this man access to this hospital, staff ID, physician credentials, access to the IR suite. That kind of infrastructure takes time to put in place. "It takes institutional access," Mara said. "Someone inside who could create a credential." "Pell," Sutter said, "or someone who worked for Pell, or someone Pell worked for." Sutter looked at her for a moment. "You think this goes higher than a COO and a trauma director?" "I think tonight's events required 3 people at minimum. Bryce for the clinical access, Pell for the institutional protection, and whoever that man is for the operational piece. That's not improvised. That's a structure." She met his gaze. "And structures exist because something is valuable enough to protect." "The asset," Sutter said quietly. "Ridgeback's been embedded here for 14 months. If he was getting close to something, if his cover identity had intersected with the right people, seen the right things, Then the goal tonight wasn't just to silence an inconvenient nurse, Mara said. It was to eliminate a federal agent before he could be debriefed. Sutter went still in the specific way he went still when a piece of information landed in the right place in a larger framework. He hasn't been debriefed, he said. He's been in surgery and IR since he arrived. We haven't been able to speak with him. I know, Mara said. They looked at each other in the dark office with the standby light of the terminal and the operator's flashlight and the amber of the emergency strips. And the thing that passed between them was not a conversation, but was its own kind of communication, the kind that happened between people who were both, in their different ways, accustomed to situations where the next decision had to be made with incomplete information and the cost of a wrong decision was not abstract. I need to get to him, Sutter said, before anyone else does. Ikikuts. IR Suite 2 was still running on backup power when they got back, which meant the monitors were functional and the equipment was functional, but the overhead lights had the flat emergency quality that made everything look slightly more dire than it was. The rapid response team had stabilized the cardiac rhythm. The calcium gluconate had held the conduction pathway long enough for the insulin dextrose protocol to start driving potassium into the cells. And the repeat EKG showed a return toward normal QRS intervals that the critical care fellow, Marcus Webb, noted with the visible relief of someone who had just had a very long 20 minutes. The patient, the man who was not David Lorne, was conscious. That was the thing that stopped Mara in the doorway. She hadn't expected it. She'd been running the clinical math on the dosage and the timeline and the intervention speed, and had arrived at probably survives with enough uncertainty attached that seeing him awake, eyes open, tracking the monitors above him with the alert focus of someone oriented to their situation, it landed differently than she anticipated. He looked at the doorway. He looked at Sutter. Something passed across his face. Not relief, not quite, but the specific change in a person's features when a variable they'd been worried about resolves. "Commander," he said. His voice was rough, intubation from an earlier step of the procedure probably, but audible. "Ridgeback," Sutter said. He came to the bedside. "Don't talk yet." "I need to talk." The man in the bed, Sutter's operator, 14 months in cover, a name that wasn't David Lorne, moved his eyes to Mara. He looked at her with the same quality Sutter had in the parking lot, recognition from a briefing photograph rather than personal history. "You're Voss." "Yes," she said. "They told me before the accident there was a nurse. In the ER I'd been flagged to, in the cover documentation, someone who was Army. His speech was coming in careful intervals, conserving breath. In case I got hurt and needed someone in the building who wasn't compromised." Mara went still. "That was in your cover documentation. Contingency contact. If the primary cover was blown and I needed medical support I could trust." He paused. "Your name was in there." She looked at Sutter. Sutter met her gaze without apology. "You built my name into a federal operation without telling me," she said. "We identified you as a potential asset anchor," Sutter said. "Your presence at this hospital was the reason we had a contingency at all. We didn't brief you because we didn't anticipate you'd need to know. I was terminated tonight, 4 hours ago. If I'd left—" "You didn't," Sutter said. "Because of the tattoo," she said. "I stayed because of the tattoo, not because anyone told me what was actually happening." "Yes," Sutter said. She looked at him for a long moment with a collection of things she wasn't going to say right now, because the man in the bed was still in a post-hyperkalemia recovery, and there were more pressing items, and the personal accounting of what she'd been used for without her knowledge could wait. She had learned in the Army to bank that kind of thing, put it in the ledger, leave it there, come back to it when the operational phase was over. "What did you find?" she said to the man in the bed. "What were you close enough to that they tried 3 times tonight?" He looked at the ceiling. He looked at Sutter. Sutter nodded. "Larchmont Procurement," the man said. "It's a medical supply contracting company, regional based out of Billings. They hold contracts with 6 hospitals in Montana and 2 in Wyoming." He paused. "On paper, they're legitimate. Surgical supplies, pharmaceuticals, equipment, maintenance." "What are they off paper?" Mara said. a front for controlled substance diversion, high-grade opioids primarily. They're overbilling the hospitals on supply orders and taking the surplus in product, medications that show as consumed in hospital records but never reached patients. He looked at her. Harlow Ridge is their biggest account. Has been for 3 years. Mara's mind was already running the connections. Bryce, she said. He signed off on supply orders. He managed the trauma department's procurement relationship with Larchmont. He authorized the billing. A pause. He knew what the surplus was going toward. And Pell? Pell managed the hospital's contract relationship at the administrative level. He reviewed the annual audits. The man's voice was getting rougher. He was fighting through it. The complaint 18 months ago, the nurses in cardiac stepped down. They hadn't found Larchmont. They'd found irregularities in medication tracking in their own unit. If that complaint had gone anywhere, an audit would have followed. Pell closed it, Mara said. Pell buried it, he said. There's a difference. The monitor above him showed a cardiac rhythm that was still not quite right, still recovering, still ironed out where it should have been crisp. Mara watched it for a moment. 3 years, she said. They've been running this for 3 years. At least, my embed was focused on the last 14 months, but the financial pattern goes back further. Was he? He shifted slightly and winced. The embolization site, the ribs, the general aftermath of a body that had been through more than it should in one night. The man they sent tonight, the one in the white coat, his name is Glenn Harker. He's a former pharmaceutical rep who's been working logistics for Larchmont for 2 years. He has no medical license. He accessed the IV line using knowledge he shouldn't have had. Which means someone coached him, Sutter said. Bryce, the man said. Bryce told him exactly what to do and what to put in the line. He met Sutter's eyes. Commander, the deletion at Pell's terminal, whatever Harker was pulling, it was the financial records, the Larchmont contracts, the internal billing documentation. We have it, Sutter said. The deletion stopped at 63%. Our tech will recover the rest. The man in the bed closed his eyes for a moment. When he opened them again, there was something in them that Mara recognized. The specific, heavy relief of a person who has been carrying the weight of a mission alone for a long time and has finally gotten to the point where they can put part of it down. Tell me what I missed, he said to Sutter. Start from when I went off comms. Later, Sutter said. Sleep. Commander. Later. Sutter's voice was firm without being unkind. Your job tonight is to not flatline. Everything else is covered. Hot. At 5:48 a.m., with the lights back on, a blown circuit in the east wing, deliberately tripped via the basement maintenance panel, which a building services tech found in 40 minutes. Once they knew to look, Harlow Ridge Regional Medical Center began to look less like a crime scene in progress and more like a crime scene that had been contained, which was a different and in some ways harder thing to be inside of. The patients on the main floor had been minimally disrupted. The overnight staff had managed the backup power period with the practiced competence of people who'd run drills for exactly this scenario, and most of the patients in non-critical beds had slept through it. The ICU and the monitoring-dependent patients had been on backup systems within seconds. The ER had continued to function. Life had kept going, which it generally did regardless of what was happening in the administrative and procedural layers on top of it. Glenn Harker was in federal custody in a transport vehicle that had arrived at 5:15. He had not said anything additional after his initial request for immunity. His white coat, taken as evidence, had a hospital ID badge clipped to it, the badge of a Dr. Marcus Toth, an emergency medicine physician who had left Harlow Ridge's employment 14 months ago, and whose badge had apparently never been fully deactivated in the system. That detail went into the federal record as evidence of the depth of the institutional failure, because badge deactivation was a basic offboarding step, and its absence here wasn't an accident. Richard Pell was escorted from the building at 5:30 by 2 federal agents. He had stopped cooperating somewhere around the 3rd hour of the interview, at which point his attorney had arrived by phone and had advised him to say nothing further, which he'd followed with the compliance of a man who had finally understood that the cooperative framing wasn't going to save him. He walked out through the hospital's main entrance in the early morning light with his coat on and his hands not yet cuffed. That would come later, with the formal processing, with the paperwork that was being assembled across 3 separate federal agencies at that hour, and the night cleaning staff who were finishing their shift, and the early morning orderlies arriving for the 6 a.m., and 2 nurses from the overnight ER shift who were clocking out watched him go. Nobody said anything, but people watched. And in an institution where Pell had been a presence for 9 years, where his signature was on the administrative paperwork that governed how the hospital ran, where his decisions had shaped the environment in which every person watching him walk out had worked, the watching was its own kind of verdict. Mara was in the break room when Darnell found her at 6:10. She was on her 3rd coffee and had been awake for 22 hours and was past the point where tiredness felt like a sensation and into the point where it had become a baseline condition that she was just operating within. "They're asking for you," he said. "Sutter's people. Conference room B." She went. The conference room had changed in character over the previous hours. Less operational hub, more documentation center. The 2 federal investigators were still there, working through file printouts with the methodical patience of people who were nowhere close to done. Sutter was at the end of the table. The Larchmont financial files that had been partially recovered from Pell's terminal were on screen, cross-referenced with hospital procurement records that Pete Warden had pulled over the previous hour with increasingly automated cooperation. "Sit down," Sutter said. She sat. "I owe you an explanation," he said. "You owe me more than that," she said. "But go ahead." He looked at her with something that wasn't quite discomfort but was adjacent to it, the expression of a man who was precise about most things and had been imprecise about this one on purpose, and knew it. "When we identified your employment at this hospital during Ridgeback's contingency planning, we ran your record, full background, full service history. We knew what you were before you got here." He paused. "We also knew about the complaints you'd filed against Bryce's protocols. They're in the HR system, and we knew about the pattern of interventions you'd made that had been consistently correct and consistently dismissed." "You were watching this hospital," she said, "before tonight." "We were watching Larchmont," he said. "Which meant we were watching this hospital, yes." "And you didn't intervene when Bryce was running a department that we were 14 months into an embed operation," Sutter said. "Ridgeback needed Larchmont intact and unsuspecting to build the evidentiary chain. If we'd moved on Bryce earlier—" "You would have spooked them," she said. "Yes." She looked at him. She looked at the files on screen. She thought about the 18 months of complaints that had been buried. She thought about the patients in the cardiac step-down unit and the nurses who'd filed the report and received a memo about communication protocols in return. She thought about Glenn Greer, who'd been dying of attention pneumothorax at 8:14 p.m., while Callum Bryce followed protocol. She thought about how much of what had happened in this hospital in the last 3 years had been allowed to continue because a federal operation needed the structure intact to build a case. She wasn't going to resolve how she felt about that in conference room B at 6 in the morning. It was too large and too complicated for this hour and this exhaustion level, and Sutter was looking at her with the particular steadiness of someone who had made hard calls and knew it, and wasn't asking her to approve of it. "What happens now?" she said. "The Larchmont records go to the DOJ Financial Crimes Unit. The medication diversion case will take time, months probably, to build the full prosecutorial structure. Bryce and Pell will be charged tonight. Harker is already in processing." He paused. "The hospital will be placed under independent federal oversight pending a full audit of procurement, medication management, and administrative compliance going back 3 years. "The nursing staff," she said. "Janet Holt? Holt's situation is complicated. She signed a false administration record, but she came forward voluntarily, and her testimony is going to be material to the case against Bryce. The federal investigators will make a recommendation." He paused. "I've already submitted my assessment that her cooperation was significant, and her actions that night, specifically not administering the medication, likely saved Ridgeback's life." Mara absorbed that. "And my termination." "Is void," Sutter said. "Bryce signed that paperwork using the same physician ID attached to the medication orders. Once those orders are part of a federal evidence record, every administrative action he took tonight is going to be reviewed. The termination will be among the first things overturned." "That's not—" She stopped. I'm not asking because I need the job back. I know, he said, but it's what's going to happen anyway. She looked at the coffee in her hand. She thought about what Darnell had said in the corridor 4 hours ago. 6 Navy SEALs just walked in behind you, and they didn't ask for Dr. Bryce. She thought about the way the room had gone quiet. She thought about Ridgeback in the IR suite, looking at her and saying, "Your name was in there," and the specific strange weight of discovering that you had been someone's contingency plan without knowing it, that the thing you'd tried to leave behind had followed you into the ordinary world and had been there waiting in a file cabinet somewhere, ready to be activated when the conditions matched. You never fully left some things. She'd known that. She just hadn't expected to find out on a Thursday night in Montana. "There's something you need to see," Sutter said. He turned the monitor toward her. On screen was a personnel file, not a hospital file, something from a federal database, the formatting different, the classification headers stripped but visible in the margins as gray rectangles where text had been redacted. At the top of the file was a name. Not Bryce, not Pell, not Harker. A name she didn't recognize. "Who is this?" she said. "The person who contracted Larchmont's secondary operation," Sutter said, "who we believe has been directing the financial structure for most of the 3 years, who Ridgeback was in cover specifically to identify." He looked at her. "Who has not been located yet tonight." Mara looked at the file, at the redacted sections, at the photograph in the upper right corner of the document. A man in his mid-60s, professional-looking, the kind of face that belonged on a hospital board or a pharmaceutical company's annual report. "He's not in the building," she said. "No," Sutter said. "We think he was never in the building. He doesn't get his hands dirty. That's Harker's function, and Harker's function before that was—" He pointed to a section of the file. Mara read it. She read it twice. She set down her coffee cup. "He's a physician," she said. "Former. His license was revoked 8 years ago." Sutter's voice was even. "In 3 states. For what?" "Patient deaths, unexplained medication events in long-term care facilities." He paused, and the pause had weight. "In 2 of the 3 cases, the facilities in question had recently changed their pharmaceutical procurement contracts." Mara looked at him. "He's done this before." "He's been doing this for 12 years, Sutter said. "Different structures, different hospitals, different front companies. Larchmont is the current iteration." He met her gaze. "And he knows tonight went wrong. He'll know by now that Bryce is in custody, that Harker was caught, that the deletion failed. Which means he's running," Mara said. "He has been for the last 2 hours, Sutter said, "which is why I have people at the airport in Billings, the bus station, and 3 ground routes east." He paused. "But he knows Montana. He has resources here. He's been operating in this region for 3 years. Mara looked at the photograph again, at the face that didn't look like what it was, which was the whole point of it, which was always the whole point of this kind of face. "You think he has a way out that you haven't covered," she said. "I think he's had 14 months of preparation for the possibility that the operation collapsed," Sutter said. "And I think there's something in that file, something in the Larchmont records that we're still working through, that tells us where he goes when things fall apart." He looked at her. "You've read the procurement files, the Pyxis logs, the administrative records. You've been in this hospital for 4 years. Is there anything you've seen in the last 4 years, any irregularity, any pattern, any place in the hospital structure that felt wrong in a way you couldn't locate?" The break room. It came to her not as a thought, but as a physical memory, a specific moment 8 months ago, arriving early for a shift and going to the break room on the 2nd floor and finding it occupied by a man she didn't recognize in a suit that wasn't hospital administrative, who was reviewing paper documents with Pete Warden and who had looked up at her entry with a very particular expression, not startled, not guilty, but the expression of someone who had a reason to be there and was fully prepared to establish that reason if asked. She hadn't asked. She hadn't thought twice about it. 8 months ago, she said slowly. 2nd floor break room. A man with Pete Warden, going over paper documents, not digital records, paper. Which was, she paused, which was unusual because Warden works exclusively digital. He's been pushing the hospital to go paperless for years. Sutter was very still. What did the man look like? Mara looked at the photograph on the monitor. She looked at it for a long moment. Then she looked at Sutter. "He was here," she said. 8 months ago. He was in this building reviewing paper records with your COO's IT administrator. And I walked in, and he looked at me, and I walked out. She heard the shape of it, the shape of having been 2 feet from something and not known what it was. If Warden was involved, if Warden knew who he was. "Warden's been cooperating," Sutter said, but his voice had changed. "Cooperating since we showed up," Mara said. "But what was he doing before we showed up? He runs the security system. He has access to every camera, every badge log, every access record in the building." She felt the thing that happened when the edges of a picture started coming together into a shape. The lights going out tonight, the blown circuit in the east wing, the maintenance panel in the basement. Sutter was already on the radio. "Where's Warden?" he said into it. Static. Then his operator's voice. "Conference room B was cleared 20 minutes ago. Warden was released. He's not." A pause. "He's not in the building, Commander." Sutter looked at Mara, and in the deepening light of a Montana morning coming through the conference room's single window, with the Larchmont files on screen and the coffee cold on the table, and every piece of the night assembled and present except the last 2 pieces, which had just walked out of the building together, or separately or in sequence, and were somewhere in the early gray of a Thursday dawn. Mara looked at the photograph of the man with the revoked license and 12 years of different names and different structures, and then looked at the door and felt the specific, cold clarity of someone who had just realized that the thing she'd thought was resolved had one more layer underneath it, and the layer was moving. Sutter was on the radio for 45 seconds, and in those 45 seconds, Mara watched him do what she'd watched him do all night. Compress urgency into the flattest possible register, because panic in a commander's voice traveled down a chain and became panic in the people who needed to be thinking clearly. All units, 2 subjects now classified as flight risks. Pete Warden, hospital IT administrator, and an unidentified male, 60s, gray hair, last seen in this building approximately 8 months ago. Pull the external camera feeds from the last 2 hours. If Warden left the building, we have him on camera. Find the exit point and find the timestamp and work backward. He lowered the radio. "The paper documents," he said to Mara. "When you saw them in the break room, can you describe them?" She thought about it. She'd been in the break room for maybe 6 seconds before she'd registered the occupants and stepped back out. She hadn't cataloged what she'd seen deliberately, but she'd been trained to look at rooms the way emergency medicine trained you to look at patients. A rapid, complete initial survey before you narrowed focus. "Spreadsheets," she said. "Printed. Multiple pages. Landscape orientation. Columns with numbers. Volume figures, I think, not dollar amounts. The man..." She nodded toward the photograph on screen. "He had a pen in his hand. He'd been marking things." "Inventory records," Sutter said. "Or delivery schedules," Mara said. "For a pharmaceutical operation, those would look similar." Sutter turned back to the monitor and opened a second window alongside the personnel file. The partial Larchmont records recovered from Pell's terminal, the 63% that had survived the deletion. He pulled up the delivery schedule column. The addresses were coded, alphanumeric strings rather than locations, which was standard for an operation trying to obscure its distribution points. But the delivery frequency codes alongside them were not consistent. Most showed monthly intervals. 3 showed weekly. "The weekly deliveries," Mara said. Sutter looked at them. "High-volume accounts." "Or staging points," she said. "Places where product accumulates before redistribution." She looked at the codes. She looked at the date ranges attached to the 3 high-frequency accounts. All 3 had been active for the full duration of the Larchmont records. One of them had a notation in a column that the deletion had partially corrupted. The last 3 characters were missing, but the first 4 were readable. HRPC. She knew what that was. "Harlow Ridge Pharmaceutical Contractors," she said. "It's a subsidiary company. They handle the hospital's on-site medication storage management, the secure rooms where controlled substances are held before distribution to the pharmacy." She looked at Sutter. "Pete Warden manages the access credentials for those rooms. He has a key card that overrides the standard pharmaceutical staff access." A place in the building where someone could store things that the standard pharmacy audit wouldn't catch, Sutter said. If the IT administrator controlled the access records and selectively edited the entry logs, yes, Mara said. And if the controlled substance counts were reconciled against Larchmont's overbilled supply records, if the paperwork showed the medication consumed by patients who never received it, then the physical surplus would have to go somewhere, Sutter said. He was already moving. All shit. The pharmaceutical secure storage room was in the hospital's basement, which was the least trafficked level of the building at any hour, and at 6:30 in the morning was completely empty except for the low hum of the HVAC system and the distant sound of the laundry service starting its morning cycle 2 corridors over. The room itself was behind a keycard door set into a concrete wall, and the door's electronic lock had a status light that was showing green, unlocked, already accessed, when Sutter and 2 operators arrived with Mara 20 seconds behind them. Sutter pushed through the door. The room was a standard pharmaceutical secure storage configuration, floor-to-ceiling shelving, locked drawers for Schedule II substances, a temperature monitoring system on the wall. It was also, in the back right corner behind a rolling shelf unit that had been pulled 6 inches from the wall, a secondary space that should not have existed. A crawl-through gap. Concrete block construction, 1 block wide, low enough that a person would have to go on hands and knees. On the other side, audible rather than visible, movement. Sutter looked at his operators. One of them went through without hesitation. Mara waited in the storage room and listened. There were 14 seconds of movement sounds. The concrete amplified scrape of bodies in a narrow space. A voice saying, "Don't in the flat command register," that meant someone was considering a bad decision and was being given one clear instruction not to, and then silence, and then the operator's voice on the radio. 2 subjects secured. Utility corridor, east basement. Commander, you'll want to see what's back here. What was back there was a storage cache that had been assembled with the careful patience of someone who had been planning for exactly this night for a long time. 2 hard-sided cases. A bag with documentation, paper records, the kind that didn't exist on any digital system. The kind that a man who had been running this operation for 12 years and had watched digital evidence bring down 3 previous iterations of his work had learned to keep in analog form. A set of vehicle keys. Montana plates registered to a name that was neither Warden's nor the man in the photograph's real identity, which the federal investigators would spend the next several weeks untangling. The man in the photograph was on his knees in the utility corridor with his hands behind his head and an operator standing over him with a flashlight. And he looked, not broken, not frightened in the way that ordinary people looked frightened, but rather like a man who had run a very long calculation and had finally arrived at an answer he couldn't argue with. His name, the real one, was Bernard Call. The federal database had him under 4 aliases. He had operated pharmaceutical diversion schemes across 11 states. He had been investigated twice and walked away both times. He was 64 years old, and he had the calm of someone who had been in rooms with federal authority before and knew how to ride out the procedural phases. What he didn't have this time was a way out that hadn't been covered, because this time the operation hadn't collapsed at its edges. It had collapsed from the inside out, through a chain of events that nobody had planned for and nobody could have anticipated, starting with a nurse who was supposed to be walking out of the building with a canvas tote bag and instead had stayed. Pete Warden, beside him, was not calm. He was the opposite of calm, the shaky, shallow-breathing, eyes-moving kind of not calm that meant he was running a very different calculation, one that involved how many years attached to how many charges, and whether the number could be reduced by the degree of his cooperation. Sutter looked at both of them for a moment. He didn't say anything in the utility corridor. There was nothing that needed to be said in the utility corridor. He looked at Mara, who was standing at the gap in the wall with her arms crossed, and her face doing the thing it did when she'd worked through a problem to its conclusion and had arrived at the other side of it. Not triumph, not satisfaction exactly, just the particular quiet of a person who had been right about something for a very long time and was now simply watching it become visible to the rest of the room. "Good call," he said. Just that. She nodded once. Yeah. The sun came up over Harlow Ridge at 7:14 a.m. on a Friday in October, and it came up the way Montana's sun came up in October, low and sharp and gold, hitting the hospital's glass facade at an angle that flooded the main lobby with light that felt disproportionate to how the night had gone, like the building itself was trying to reset. Bernard Call and Pete Warden were transported in separate vehicles. Callum Bryce had been in federal holding since 6 a.m. Richard Pell had been formally arrested at 6:45. The paperwork processed. The cuffs applied in the administrative corridor outside his office by two federal agents who did it without particular theater and without particular gentleness. By 7:30, Harlow Ridge Regional Medical Center had a federal oversight liaison physically on site and three separate investigative teams working through different layers of the institution's records. It was going to be a long process. The medication diversion case would take months to fully prosecute. The civil liability questions would take longer. The institutional damage, the trust damage, the structural credibility damage, the question of what the hospital had been and what it needed to become, that would take years. None of that made the morning less real. In IR Suite 2, Ridgeback, whose real name was James Foley, which Sutter told Mara at 7:15 with the specific kind of trust that meant she had been formally moved from contingency contact to cleared individual in whatever mental framework he used for these categories, was awake and irritable and demanding to be debriefed, which was, "Doctor." Sylvie Orr told him, with the patience of a woman who had saved his life twice in one night and felt entitled to at least 6 hours of compliance, not happening before his cardiac rhythm had been stable for a minimum of 4 hours, and she'd done a repeat ultrasound of the embolization site. "You can debrief from the bed," Orr told him. "I've been debriefed in worse positions," he said. "I don't doubt it. You're still not getting up." Mara passed the suite door at 7:40 and looked in through the glass. Foley was sitting up at a 20-degree incline, talking to Sutter with the concentrated energy of a man working through 14 months of accumulated information. Sutter had a recorder on the bedside table and a notepad in his lap and was listening with the total focus of someone receiving a report they'd been waiting a very long time for. She didn't go in. It wasn't her room anymore. It had been her room when he needed her clinical judgment and her access and her particular history, and now it was Sutter's room, which was appropriate. She'd done her part of it. She kept walking. Darnell found her in the locker room at 7:55. She was sitting on the bench in front of her old locker, the one she'd cleared out 6 hours ago, the one that was technically no longer hers, with the canvas tote bag on the floor beside her and her arms resting on her knees. She wasn't doing anything. She was just sitting, the way you sat when you'd been moving for 22 hours and your body had finally issued a statement that it was no longer interested in moving. Darnell sat down beside her on the bench. He didn't say anything immediately, which was one of the things about Darnell. He had a gift for understanding when words needed to come after silence rather than instead of it. After a while, he said, "They're pulling the termination. HR got a notice from the Federal Oversight Liaison at 7 a.m. All administrative actions taken by Bryce in the last 48 hours are suspended pending review." "Sutter told me," she said, "you're still on payroll. Technically, you never weren't." He paused. "Also, technically, you worked the last 6 hours off clock and there's no mechanism to comp it, so that's less good." She almost smiled. "Noted." "Lena's been telling people," he said, "about the fast exam, about the potassium, about the lights going out and you staying." He paused. "People are going to want to talk to you." "I know. Are you okay with that?" She thought about it genuinely. "Ask me after I've slept." He nodded. He looked at the locker in front of her. "You want your stuff back in there?" She looked at the locker, the photo of her and her brother at his graduation, the paperback she hadn't finished, the small, ordinary objects of a working life that she'd packed into a bag 6 hours ago when she believed she was leaving. "Yeah," she said, "I do." She slept for 5 hours in the on-call room on the second floor, which was not a good place to sleep. Thin mattress, the persistent sounds of a functioning hospital, but which was sufficient because she had slept in worse places than this, and her body had learned to take rest where it found it. She woke at 1 p.m. to 3 missed calls from her brother, who had seen something on the regional news feed, a brief item about a federal investigation at a Harlow Ridge hospital and administrative arrests. and had connected it to her text the previous night, and was, based on the voicemails, operating somewhere between worried and furious that she hadn't called. She called him back. "Are you okay?" he said, before she'd finished saying his name. "I'm okay." What happened? She looked at the ceiling of the on-call room. She thought about how to summarize a night that had started with a termination notice and a canvas tote bag, and had ended with 2 men in federal custody in a hospital basement and a classified operator stable in IR, and her own locker restocked with a paperback she still hadn't finished. "It's a long story," she said. "I'll tell you this weekend." Mara. "I'm okay, Eli," she said. "I promise. I'll call you Saturday." She could hear him deciding whether to push. He was 29 and he'd been worrying about her since she came back from the army, and he'd never quite stopped, because the version of her he'd been worrying about was not the version she'd let him see. And at some point she was going to have to fix that. Let him see more of the actual shape of things. "Saturday," he said finally. "Saturday." At 2:30 p.m., Sutter found her in the main corridor near the nursing station where she had taken up an informal position, not officially on shift, just present, answering questions from the nursing staff, who had a lot of them, helping the federal oversight liaison understand the department's normal operational flow, so he could identify where the abnormalities had been embedded. She was useful. That was the simplest version of what was happening. She knew this institution better than anyone the federal teams had brought with them, and so she was being used, which was fine with her, because being useful was the state she'd been most comfortable in for as long as she could remember. "Walk with me," Sutter said. They walked to the end of the corridor where a bank of windows looked out over the hospital's east parking lot, the same lot where the black SUVs had pulled in at midnight. In the October afternoon light, it was just a parking lot. A few cars. The ambulance bay empty at the moment. A man in a maintenance jacket doing something to a light pole near the entrance. "Foley's stable," Sutter said, "or cleared him for limited activity this morning. He's been debriefed." "Good." The Larchmont investigation is being transferred to the DOJ Financial Crimes Unit. They'll be coordinating with the FBI and the DEA. He paused. "It's going to be one of the larger pharmaceutical diversion prosecutions in the region in the last decade." "How many hospitals?" she said. "Across all 11 years of Call's operation? We're looking at 8 confirmed, possibly 12. We're still building the picture." He looked at the parking lot. "A lot of patients, over a long time. Medications that should have reached people in pain and didn't." She'd thought about that in the 5 hours she'd been sleeping, the way you thought about things in sleep, not sequentially, not with the linear logic of a waking mind, but in the compressed associative way of a brain processing what the day had deposited. She'd thought about Howard Fisk in Bay 3, grumbling about his IV. She'd thought about the cardiac step-down nurses who'd filed a complaint 18 months ago and gotten a memo about communication. She'd thought about all the patients in between, the ones she'd known about and the ones she hadn't, the ones who were fine and the ones who weren't, and the long, slow gap between an institution failing and anyone with the authority to stop it actually doing so. "You asked me last night what I'd seen that felt wrong," she said. "In 4 years here." "Yes." The honest answer is, a lot. She looked at the parking lot. Not all of it was Bryce or Call. Some of it was just how institutions run, the way seniority protects itself, the way complaints disappear into review processes that were designed to make complaints disappear. She paused. "I've been watching it happen for 4 years, and my response to it was to document carefully and stay quiet and tell myself that being right in the room was enough. That if I just kept being right, eventually it would matter." "It did matter," Sutter said. "Last night it mattered. But last night needed a classified federal operation and an operator in a ditch on Route 9 to create the conditions where it was allowed to matter." She looked at him. "That's not a sustainable system." Sutter was quiet for a moment. "No," he said. "It isn't. The oversight structure that's going in," she said. "The independent audit. I want to be part of that, not just cooperating with it, structurally part of it. The nursing staff needs someone who is inside this department, who knows where the pressure points are, Who can tell the auditors which records to look at and which processes need redesigning? She held his gaze. I want a formal role in the review. That's not my call, he said. That's the oversight liaison. I know. I'm telling you because you can make the introduction. He looked at her for a moment. You're not going to go back to just being a floor nurse. I'll be a floor nurse, she said. That's the job. That's what I came here to do. She paused. I'm also going to be the person who makes sure what happened here doesn't get papered over in the cleanup. Those two things aren't in conflict. Sutter was quiet. Then he said, I'll make the introduction. Pian. The meeting with the Federal Oversight Liaison happened at 4 p.m. in Conference Room B, which had been cleaned and returned to a more functional configuration and now smelled of coffee and printer paper rather than the previous night's particular mixture of stress and urgency. The liaison was a woman named Diane Ostroff, 50s, practical, with the manner of someone who had overseen enough institutional audits to have lost any remaining illusions about how institutions worked, but had not lost the willingness to try to make them better. She listened to Mara for 40 minutes without interrupting. At the end of the 40 minutes, she said, You understand this process is going to be difficult. People in this institution are going to resist. Some of them will have lawyers telling them to resist. I know, Mara said. And you're aware that your own HR record is going to be part of the audit. My HR record was written by a man who is currently in federal holding, Mara said. I'd welcome the audit. Ostroff almost smiled. We'll structure a formal consultation role. You'll be compensated at the advisory rate. She made a note. I want you at the first nursing staff session next week. The staff needs to understand that what's being built here is something they're part of, not something being done to them. Agreed, Mara said. One more thing. Ostroff looked at her directly. Off the record, because this is a human conversation and not a procedural one. How are you doing? Mara looked at her. She wasn't a person people asked that question of very often, and the ones who did usually got a reflexive fine that ended the inquiry. She found herself actually considering it instead. I'm tired, she said. I'm going to be processing last night for a while. And there are things about how this operation worked, how I got used without being asked, that I'm not done thinking about. She paused. But I'm also cleaner than I've been in about 4 years. Lighter. Like something I'd been carrying had a shape I couldn't see until it was gone. Ostroff nodded. That's an honest answer. I've been practicing, Mara said. James Foley was transferred to a federal medical facility outside Billings on Saturday morning, which was a logistical necessity given the nature of his case, but which Mara was privately glad about, not because she wanted him gone, but because his presence in IR Suite 2 had been making the department feel like an ongoing operation rather than a hospital, and the hospital needed to start being a hospital again. Before the transfer, he asked to see her. She went to the suite at 8 a.m. He was sitting up properly now, the monitor leads reduced to the essential 3, the IV down to a single maintenance line. He looked better than he had any right to look given what his body had been through in the previous 36 hours, which she attributed to the particular physical durability of people whose careers required them to recover fast. I wanted to say thank you, he said, not for Sutter, for me. You would have survived, she said. The rapid response team. I would have died in the trauma bay before anyone ran the fast, he said. We both know that. He held her gaze. I know about the termination. I know you were walking out. I saw the tattoo, she said. Yes, he said. But you stayed before you saw it. You stayed because the man on the gurney was going to die. She didn't argue with that, because it was true, and they both knew it. You were put in my contingency documentation without being asked, he said. I found out about that when Sutter briefed me. For what it's worth, I didn't know. I know you didn't. Does it bother you? She thought about it honestly. The way it was done bothers me. What it produced. She looked at the monitor, the steady rhythm on the screen. I can live with what it produced. He nodded. He looked like a man who understood the difference between the principle and the outcome, and had spent enough time in operations where the two didn't always align to know that the distinction mattered. "The name Voss," he said. "In the documentation you were described as—" He stopped. The file description was Asset Anchor, Sipat Asumitish Anchor, exceptional clinical and tactical profile, likely will not need to be activated. Likely, she repeated. They were wrong about the likelihood. They were wrong about a lot of things, she said. They were right about the clinical profile. He almost smiled. It was the first time she'd seen anything close to it on his face. Get some rest, she told him, because she was still in the room a nurse, and old habits were not just old, they were structural. You've got a long debrief ahead of you. I know. He settled back against the inclined bed. Voss. Yeah. For what it's worth, and I know this doesn't fix the parts that were wrong, the work you did here mattered, not just last night, the 4 years of it, the documentation, the complaints, the staying. He looked at her. It all mattered. Call's operation held as long as it did partly because people like you were being systematically shut down before you could accumulate enough to be dangerous. What broke it last night wasn't just us. It was everything you'd already built. She stood in the doorway of the suite with the October morning coming through the window behind him, and she thought about 4 years of careful documentation that had been filed and reviewed and dismissed, and the particular loneliness of being right in a room that had decided not to hear you, and the way that loneliness could become a kind of identity if you let it, could become the whole story of who you were in a place, the nurse who argues, the one who pushes back, the difficult one, and how much of her 4 years here had been spent inside that identity, half convinced that the identity was all there was. I know, she said, and she did. She was beginning to. That 3 weeks later, on a Tuesday afternoon, the main lobby of Harlow Ridge Regional Medical Center held more people than it typically held on a Tuesday afternoon. The federal oversight process had been running for 18 days. 2 preliminary audit reports had been filed. The Larchmont prosecution was formally underway, with Bryce and Pell having entered pleas that their respective attorneys were already publicly characterizing as the beginning of cooperation agreements. The institutional instinct for self-preservation expressing itself even in the legal strategy of men who had done what they'd done. Bernard Call had said nothing. He had a legal team that cost more per hour than most people made in a week, and they were working through a jurisdiction argument that everyone involved knew would ultimately fail. And everyone involved knew would buy him time, which was the only currency still available to him. Harlow Ridge itself was changing in the visible, incremental way that institutions changed when the external pressure was sufficient and sustained. New medication tracking protocols, revised procurement oversight, an independent pharmacy audit running alongside the federal process, nursing staff complaint procedures that now routed outside the administrative chain entirely. Small things, bureaucratic things, the kind of changes that looked minor on paper and were enormous in practice for the people inside the system. The lobby gathering had been organized by the nursing staff, not by administration, not by the oversight liaison, not by any official process, by the nurses, Lena Park and Darnell Okafor, and 6 others who had decided on their own that the story of what had happened at Harlow Ridge needed a public moment that wasn't a press release or a federal proceeding, something that happened in the building itself, in the place where the work was done. James Foley walked in on his own. He'd been cleared for discharge from the federal facility the previous Thursday. He was moving carefully. The embolization site still required care, and he'd been told by 3 separate physicians to take it easy for another 4 weeks, which he was interpreting as loosely as a man with his particular professional formation was capable of interpreting medical advice. He was in civilian clothes, and he walked with the particular deliberateness of someone managing pain without showing it, which was, Mara thought watching him come through the door, probably a habit formed over a very long time. Commander Sutter was with him, and 4 members of Sutter's team, and Diane Ostroff, and 2 of the federal investigators, and the state medical board representative who had been on site for the audit review, and the Attorney General's office liaison who had driven from Helena that morning. The lobby was not a ceremonial space. It had plastic chairs and a reception desk and a coffee kiosk that was doing its regular Tuesday afternoon business, and a television on the wall cycling through regional news. The morning cleaning staff had done their usual job. Nobody had set up a stage. Mara was standing near the nursing station off the lobby with Darnell and Lena and the overnight crew who'd come in early, and she watched Foley come through the door, and she felt the specific, complicated thing that she'd been feeling for 3 weeks every time the events of that night assembled themselves in her mind. Not pride exactly, not relief exactly, something that didn't have a clean name, that was made up of too many components to reduce. Foley saw her and walked toward her. Behind him, Sutter walked toward her. The lobby had gone quiet in the gradual way of a space where people have sensed that something is happening without being told. Foley stopped in front of her. "How's the sight?" she said, because it was the first thing she thought, and it was the honest first thing. "Sore," he said. "Orr told me not to stand for long periods." "Then sit down." In a minute, he looked at her with the directness of a man who had been thinking about what to say for 3 weeks and had arrived at something simple. "The thing about a contingency plan," he said, "is that it's only as good as the person at the center of it. We got lucky with the person we put at the center of ours." "You didn't put me anywhere," she said. "I was already here." "Yes," he said. "You were." Sutter stepped forward. He was holding a presentation case, flat, formal, the dark blue of official documentation. "This is outside my normal operational territory," he said, with the first suggestion of something like self-consciousness she'd heard from him in 3 weeks. But it seemed right. He opened the case. Inside was a citation, formal, printed on the kind of paper that conveyed permanence, with the insignia of Naval Special Warfare at the top and a signature at the bottom that Mara recognized as belonging to someone considerably above Sutter's pay grade. The language was precise and brief, in the way that official recognition language was when it was written by people who understood that the facts of a thing, stated plainly, were more powerful than any embellishment. For exceptional medical expertise and personal courage demonstrated under pressure, resulting in the preservation of a federal asset's life and material contribution to a significant federal investigation. Below it, her name. Rank restored in the language of the citation, Lieutenant Mara Voss, U.S. Army, retired. She looked at it for a long time. She was aware of the lobby around her, the nurses, the staff, the morning patients in the plastic chairs who had stopped looking at their phones, the television cycling on the wall, the coffee kiosk, and the reception desk, and the ordinary, persistent machinery of a hospital running on a Tuesday. She was aware of Darnell beside her, and Lena behind her, and the overnight staff who'd come in early, and the day shift beginning to arrive and stop in the lobby because they'd heard something was happening. She was aware that she was standing in a place she'd tried to leave 3 weeks ago with a canvas tote bag and a termination notice, and that the leaving had not taken. She looked up from the citation. Sutter straightened, and he saluted her. Foley beside him straightened as well, carefully, with the consideration of a man working around a healing embolization site, and saluted. The 2 operators behind them followed. In the lobby of Harlow Ridge Regional Medical Center, on a Tuesday in October, 4 members of Naval Special Warfare stood at attention and saluted a nurse. Mara stood there for a moment and let it land. The whole weight of it. Not just the citation, and not just the salute, but everything underneath them. The 8 years she'd spent in places the paperwork didn't fully describe. The 4 years she'd spent being systematically told that what she knew didn't matter. The particular loneliness of being right in rooms that had decided to make rightness costly, and the night that had cracked it all open. She had not been looking for recognition. That was the thing she wanted to be honest about, even now, even with the lobby quiet around her and the citation in her hands. She had not stayed that night because she thought it would lead here. She had stayed because there was a man on a gurney who was going to die, and she was the person who knew how to stop it, and that was the whole of it, the complete and sufficient reason, the only one that had ever made sense to her. You didn't need a title to do the right thing. You didn't need permission or rank or an institutional endorsement. Sometimes you needed to be the person standing in the right place at the right moment with the right knowledge and the willingness to use it regardless of what it cost. She had paid some costs. She would pay more. The audit was going to be hard. The institutional change process was going to be slow and resistant and frustrating. And she was going to spend the next year in rooms with people who didn't want to hear what she had to say, the same way she'd spent the last 4 years. That hadn't changed. What had changed was her relationship to the cost. She returned the salute, clean and correct, the way she'd been taught, the way her body still knew without thinking. "Thank you," she said. And then, because it was true, and because the truth was the only currency she'd ever been able to afford, he would have died. "I couldn't let that happen. That's all I did." "No," Foley said. He shook his head slightly. "That's not all you did. That's just all you were willing to call it." Lena Park, behind her, made a sound that was not quite a laugh and not quite a sob, and was very specifically the sound of someone who had been holding something in for a long time. Darnell Okafor put a hand on Mara's shoulder for exactly 1 second and then removed it, which was the Darnell version of a considerable emotional expression. Around the lobby, the morning kept going. A monitor beeped somewhere down the corridor. A patient was being wheeled in from the ambulance bay. The day shift was arriving, clocking in, picking up handoff notes, beginning the specific and unending work of caring for people who needed it. Mara looked at the citation one more time. She folded it closed along the case's center line. She handed it to Darnell. "Put that somewhere," she said. "Where?" "Somewhere it won't get lost." She was already moving toward the nursing station, toward the handoff board, toward the shift that was starting without her if she stood still any longer. "I've got patience." She pulled on a pair of gloves at the station, the way she'd done 1,000 times, snapped them against her wrists, and turned to the board to read the overnight notes. And the morning opened up in front of her with the uncomplicated clarity of a shift beginning. A voice came over the overhead. "Room 4, the ER." A new admission coming in from the ambulance bay. She went, not because anyone saluted her, not because her name was on a citation, or her personnel record was clean, or the institution had finally decided she was worth listening to. She went because there was a person coming through the door who needed help. And she was the help, and she always had been. That was the thing no one had ever been able to take from her. They'd taken the title and the roster spot and the locker and the shift. They'd taken 4 years of professional standing and replaced it with a pattern of deliberate dismissal dressed up as clinical authority. They'd handed her a termination notice at midnight and expected her to use the exit. She had not used the exit. And the reason she hadn't, the reason she never had, in any room, in any situation, at any cost, was not because she was exceptional. It was because she understood, at a level that had become structural in her, that the person on the gurney didn't care about the politics of the room. They didn't care who'd signed what paperwork, or who held which title, or whose ego was at stake in the outcome. They were just a person in the worst moment of their life, arriving at a door and hoping that whatever was on the other side of it was paying attention. Mara Voss had always been paying attention. She walked into the trauma bay and pulled on the second glove and looked at the paramedics coming through with the gurney and said, "Tell me what you've got." And they told her, and she listened, and she went to work.